The most common operation in the United States done for neck and arm pain is called an anterior cervical discectomy and fusion. It's a lot of words. It's a surgery done through a very small incision in the front of your neck. I've actually had an ACDF done. And if you look closely, you might be able to see my small scar right here. It's done through a 1-inch incision, and it exploits a plane between your throat and your carotid sheath. And there's fortunately no muscles to go through, which is why it's such a better recovery time than any kind of posterior operation on your neck, where you have to go through the muscles to do the surgery. The surgery usually takes a short period of time. It can be an outpatient or overnight stay, usually a collar for 4 to 6 weeks, and the patient can return to almost full activity by 3 months. Very good operation to relieve both neck and arm pain. And I'll show a couple of examples of models here that we have that explain how that works. So as we discussed previously, there's nerves coming out in each level here, and there's a disc right here. When this disc herniates or collapses, it narrows a space where the nerves can come out, and you can kind of see how that can narrow down. What we do for the anterior cervical discectomy fusion is to actually incise the disc, and we'll actually take out most of the disc. We'll clean out around the spinal cord and nerves. If we did nothing after that, the disc would just collapse and not have any structure, and the space for the nerve would narrow. So we have two choices. We can either put a cadaveric piece of bone where the disc used to be, or we can put a device called a cage, which holds the disc space open and allows bone to grow through this. This particular model has a plate and screws on the front to help hold it still while it heals, and a cage that's into the disc space. It's very hard to see on this particular model, so I'll show you what an actual cage looks like. And it's a very tiny piece of a plastic type material called PEEK. It has a titanium coating on it that allows bone to ingrowth, and this will fit into the disc space and allow bone to grow through the cage, through the opening in the cage, hence the term cage, and around the cage. And at the same time, this device will hold the disc space open so the exiting nerve has no pressure on it and cannot recollapse.